Many factors are responsible for the spread of cholera. These include poor hygiene and contaminated food or water.
We have about 4 wells which are for drinking, and that is one that somebody was carrying water within that previous time.
For instance, this community here relies on this shallow well for drinking water.
I could come fetch it, but as you see this rubber, I see cow for come drink this water.
Arise News speaks with a health expert on other factors responsible for the spread of cholera and how Nigeria is well prepared to tackle the spread of the disease.
When somebody takes water or food, when I say food, fruits, whatever that is contaminated or contains the bacteria, the Vibrio cholerae, after about 12 hours to 24 hours to 1 day to 2 days to 3 days, sometimes up to 5 days, the person will come down with very acute diarrhea that is profuse. In the case of cholera, the diarrhea is very profuse, it is very continuous, it is associated with vomiting and nausea, but more importantly, one of the key things you use to distinguish it is that the stooling looks almost like pure water. And that's why they describe it like rice water.
Does Nigeria have enough vaccines to tackle the menace? What other ways can cholera be prevented?
What they can do, one, they can do purification of water. Purification then, I mean, there's a chemical, chlorine, that can be added to water, and it would kill off the bacteria. They can also boil their water. Boil water, cool it, put it in a pot or bucket that is covered, and then they use it for drinking. Those are the two major things they can do. Then, of course, that's for the short term. For the long term and a general practice, they should have a source of safe drinking water. Right now, there's a shortage of cholera vaccines. There's no way you're going to have enough vaccines overnight for everybody. Using vaccines is not as difficult as people think. If the government wants vaccines produced in the country, they can do it within months. Some of them within years.
Nigeria is faced with several outbreaks, particularly cholera. It's been a talk for over months now, yet we have over 107 deaths from cholera, over 1,000 cases. What can be done to bridge the gap to ensure that structural issues are put in place, besides talking about the disease, besides talking about hygiene? What can the state governments do? We meet with the Director General of the Nigeria Center for Disease Control to talk about the solutions and factors to bridge this gap.
States with either high population or high population density, let's put it that way, then poor development areas are more likely, predictably, to have more cases. Comparing the fact that even if you have those states, what will be the state of water supply to those people? What is their access to water? What is their access to sanitation? What is their access to hygiene, both personal and environmental? So you understand me? So if you consider those factors, I know that the key factors when it comes to cholera. Cholera is a disease of, development.
What states are most likely to be affected as the rainy season continues? Plus, what local government has the highest record of deaths from cholera?
We have 3,807 suspected cases, 107 deaths, case fatality of 2.8, all from about 188 local government areas and 34 states. Out of the 34 states, 12 states, they have different facilities, but the 12 states are contributing to almost 92% of those cases. Now, and those states, 10 of them are Lagos, Bayelsa, Katsina, Ebonyi, Abia, Zamfara, Delta, Bauchi, and maybe Cross River and Ogun. Ogun is just 1%, and we will add Ogun to it. We have 15 local governments accounting for 57% of all cases. The local government area that has the highest number, 9%, is from Lagos.
Yes, it's from Lagos.
Lagos Island.
Lagos Island.
Yes, Lagos Island local government.
One thing is clear: conflict, unplanned urbanization, climate change, literacy level, population congestion, and more are social factors responsible for the spread of cholera.
If you want to plan for a city, there are many factors to consider. What will be its population? What will be the composition of that population? What would they require in terms of, water requirements, sewage requirements, whatever. These are part of that general planning. Then they develop those designs. When you design, toilet facility be here, sanitary facility be there, all those things. But unfortunately, many states do not get to do this. Water is an issue. It's not something I immediately do. It requires piping. It requires creating water, whatever it is, facility where water is produced. So, but you can't do that in one fell swoop. And that's why we say that for those places where you are recording cholera, especially where they don't lack water, perhaps government or local government, state government will provide temporarily, maybe mobile water tankers to those facilities. For them, they will have access to something reasonable.
From the federal to state and local government, these structural gaps need to be bridged to ensure that Nigerians are safe from outbreaks. Health experts say Nigeria needs to step up its efforts towards surveillance and preparedness to better handle cholera outbreaks. Olije Wapera, Arise News.